Today we're going to be talking about the parameters and settings in which we can change our ultrasound machine to. And we always want to start by recognizing what the impairment is that we are looking to treat. And really there are two circumstances in which we can use ultrasound. So ultrasound can be used for soft tissue shortening, or it can be used when a patient has delayed tissue healing or prolonged inflammation. When we are looking at soft tissue shortening, we want to heat the tissue and we want to be able to stretch it out. So soft tissue shortening is going to require a thermal effect of ultrasound, and this is going to require us to set the duty cycle to 100%. This is a continuous wavelength, and again, this is for a thermal effect. When we are looking at delayed tissue healing and prolonged inflammation, we want a non-thermal effect of ultrasound. So we're going to come over here on our diagram, and that will require us to use a duty cycle of 20%. So this is non-continuous or a pulsing wavelength. So that's step one when using ultrasound. Step two would be determining where the depth of the issue is, or what area we are trying to treat. So for things that are closer to the surface, it's going to be the same regardless of whether we're using ultrasound for heat or not. When the structure is closer to the surface, 1 to 2 centimeters deep, we want to use the 3 megahertz frequency. Ultimately, 3 megahertz is going to reach deeper structures, and is going to be the opposite for structures that are actually deeper. So deeper structures, we're going to set the frequency to less. We're going to set it to 1 megahertz. Again, that is regardless of the effect of ultrasound. Going forward, we're going to come back to the thermal side of things. So once we have determined where the structure is, we can determine our frequency. Once we have that, we want to determine the ultrasound intensity. Now, the intensity is going to somewhat offset the frequency. So if we are using a higher frequency of 3 megahertz, we want to use the lower intensity because this frequency is going to achieve the effect faster. Thus, we want to set the intensity a little bit lower because we don't want to burn our patient and provide too much heat. And if we have the opposite, we have 1 megahertz for frequency, then we can use the higher end of our intensity, 1.5 to 2. However, when we come over to our non-thermal side of things, this is always going to be the same because it's non-thermal. So our goal is not to heat this area, and therefore it's simple. We are going to just use the lower ultrasound intensity. Lastly, we have the duration of treatment, and luckily this is also the same regardless of thermal or non-thermal ultrasound effect. It's always going to be 5 to 10 minutes per 2 times the ERA. So an area that is 2 times the ERA is going to receive 5 to 10 minutes of ultrasound. So by using this diagram, it's pretty easy to follow and determine the proper parameters in order to use ultrasound. Once again, all based upon our original impairment.